Welcome to Conversations with Black Doctors, brought to you by Austin Black Physician Association, also known as ABPA. My name is Dr. Jeff Hutchinson. I'm a physician here in Austin, Texas, and I'll serve as the moderator for this panel. Mission of the Austin Black Physician Association is to improve health disparities within our community and to inspire the next generation of Black doctors. If you're interested in learning more about collaborating with ABPA, please visit austinbpa.com to connect with us. That's austinbpa.com. The purpose of this webinar, we decided in 2021 to make this more of a conversation. We want to talk to you like we talk to our family, because you need to know who we are and you need to know that we care about you. Today's topic is about advocating for yourself. With me today is Dr. Chinwe Efribe and Dr. Tracy Asamoah. And to keep this informal, although women are often, their titles are often dropped, today we're going to use our first names just because we know each other and it's going to be familiar. So I want to thank you for joining us, and we're going to jump right into it. Chinwe and Tracy, thank you for being here today.
Thanks for having me.
Thanks.
All right, so advocating for yourself, a story that all of us have heard in the news that really just breaks our heart, is about Dr. Susan Moore. She is a Black physician, was a Black physician who unfortunately died of COVID, and she filmed how she was being cared for in the hospital, or the lack of care that she received. She was begging to get the treatment that she knew she needed. But even as a physician, she was unable to be treated properly, and she died. Tell me how you felt when you heard about the story, when you heard about what happened to her. And I'll start with you, Chinwe.
Yeah, that story was so heartbreaking, because I came across it as a member of the physician moms group called PMG on Facebook. And I wasn't even aware of her footage until after she'd passed. And I just saw a note from the organizer of this Facebook group, who gave like a strong statement about how we definitely need to recognize racism and disparities, and how it affects really everyone, regardless of, status, in a sense. And it wasn't until then that I was confused as to what had happened. And then I looked back and said, oh my goodness, this woman literally documented the journey to the end of her life. And what hurt me the most was that that journey was she did it alone to some degree, because she commented on how she was there by herself, and she was trying to get information from the physicians that were caring for her, and she felt like they weren't hearing her when she was telling them, I can't breathe, or I'm having troubles breathing. And to some degree, she had to fight for the imaging that she ended up getting that proved that she was truly in distress. And it just, it broke my heart, because it's like, how much do I need to prove my distress level? Like why does it take so much for people not to believe when certain populations or certain people or individuals are expressing themselves? And I understand, a lot of research that has gone out into pain and pain management, and how some race and ethnicity status, statistics may have kind of trying to figure out a word for it, but discolored or stigmatized or created some bias against certain populations. So anyone coming in requesting for pain control, there's always this struggle that the physician has to make to decide, well, I don't want to add to the opioid epidemic, but I also want to care for this patient. But again, it's a hard balance to make. But long story short, it hurt my heart. I felt for her, and I could go on and on. And it's just, it was just hard.
Yeah, thank you, Chinwe. You're not alone. That story affected so many of us. Tracy, what did you think when you heard it?
Yeah, I similar to Chinwei, I didn't hear about it until after the fact and kind of learned how she documented her journey. And initially, I was just so incredibly saddened that anyone should experience that. But that again, especially folks of color, Black folks, seem to consistently have this sort of experience. And I was disheartened because I would have hoped that we would be getting to a point where physicians would realize that they have to look a little bit differently at how they handle different patients, knowing that implicit bias and explicit bias is a real thing. It's not, because we're doctors and we're trained, we're not free from some of the same things that everybody else deals with, the same sorts of biases, and that there's still such a huge gap in how doctors are trained in understanding that this is a real thing, and that there aren't safeguards in the system to protect patients, because even if we know that, we would hope that our doctors see all patients receiving and deserving of the same care, that we live in the real world, and we know that patients do have to sometimes fight a little bit harder to get what they need, and that there aren't really good systems in place for patients to be able to do that. And so I was sad and disheartened, encouraged that at least her story got out there, and that perhaps maybe with her story being out there, that it's another reason, another bit of motivation to do something about this. Like Chinwe, I was just in a very personal way, very sad that she went through that alone, and can't really imagine what she must have felt. Um, and to be honest, I, in a very different type of circumstance, have been in the same sort of situation where even though I'm a physician, for some reason, because I'm a Black female, I've been questioned about what I knew to be true about what was going on with my body. And I get it, because physicians do have to make decisions about whether or not something that a patient is reporting is crucial to understanding what's going on with them, and they have to decipher and make some decisions about that. But that's different. Making judgments about what's going on with the person sitting in front of you from a clinical standpoint is different than working from a point of bias and working from a point of presumptions you make about the person sitting across from you. And so I get it from a very personal level of what she experienced. Unfortunately, she had this horrific outcome. It didn't have to be that way for her.
Yeah, Tracy, your comments bring back how I was feeling. And me, I was a little sad, yes, but I was more angry.
Yeah.
I was more mad at the experiences I've had throughout my career
Mhm.
of seeing how different people are treated differently.
Yeah.
The study that came up that there are medical students and residents and physicians who believe Black people feel pain differently than white people. And it just gets expressed all the time.
Yeah.
And when she was in distress, barely able to breathe, and saying they're not listening, they're not believing me, I saw my family. I saw someone who could very easily have been through the exact same thing because there was not someone else there to advocate for her. You think as a physician that would be enough, but I know that as a physician, when my wife needs help, that helps to get her what she needs. So it just is so infuriating to me that it takes that much extra work to get the same level of treatment that other people need. So that's how I felt. What would you all say to family members, or what have you said to family members in the past who have had trouble in the health system?
I know for me, I always tell them to set expectations with their providers early. Just be honest and be clear about what they're hoping to get out of their visit, because sometimes there could be miscommunication and there could be bias there at the beginning. But if you're able to tell your provider, this is the main reason I'm here. This is the my chief complaint, literally my chief complaint, start there. Because as you give the history, it might go on tangents, but at least hope that the provider hears the main reason. And then from there, I always tell them, track your progress, because you don't want to relinquish all your faith into either, one healthcare team. At the end of the day, yes, we were trained and the teams are trained, but everyone's human. And so it's really important for the patients or my family members to be able to say, hey, am I feeling better? Or am I feeling worse? Or did I like the way that this person communicated with me? Are they hearing me? Like when I tell them something, are they hearing me? Or do they already have a script in their mind that they have prepared and are just regurgitating that script based on a constellation of information that I shared with them? So I just told them, just, be observant, but definitely tracking that progress. Because once you can track your progress, then it'll allow you to decide, okay, have I gotten to a point where this particular provider can no longer help my chief complaint? Because if you're still having that issue and you're still wondering, I keep coming to this person and they keep giving me this, but I'm still not, then it's time probably to consider seeing someone else. And, that's really how I approach it with them.
That's great. Tracy, can I weave off that a little bit?
Mhm.
Chinwe talked about should see somebody else. What do you tell people about second opinions? Like, how do
Yeah.
you get people to advocate for themselves when they need to see somebody else?
Yeah, and I'll start kind of where Chinwe left off, and I think this is because I'm a psychiatrist, and we think this way, but I'm all about feeling comfortable in the relationship with your healthcare provider. As much as you're able to, you want to be able to choose physicians that you trust, that you feel like to the best of their ability, they're working for you in your favor. They're trying to help you feel better. And it's not always possible. If you're seeing someone who is in a super, specialized field, you might not be able to have a whole lot of choice about who you see. Or if you're limited for other reasons, financial reasons, your insurance plan, where you live, all of those things that can limit sometimes your choices. You can't always choose the person you see, but as much as you're able to, I say start there, feel good about the relationship. As far as a second opinion is concerned, I think I always start with you are the best advocate for your own health. You know your body, you know what you're experiencing. So first and foremost, be very clear about how you're communicating with your physician. Know why you're there to see them. Don't ever assume that they know what's going on in your body. You have to be able to tell them exactly what you're experiencing. And if you feel for some reason that you're not getting an answer that makes sense, and it could just be that they're not explaining in a way that makes sense, it could be that you disagree with what they're saying. I think it's completely okay to get a second opinion, but I want to be very clear about a second opinion. A second opinion often means that you are getting another opinion about what's going on. It doesn't always mean that you're switching to finding a new doctor. So if you still want to continue working with your doctor, let them know, hey, I would like to get someone else just to give me another fresh perspective. I wanted to talk to you about that first. That your physician may even help you understand the things that you might want to ask this other person about. They might even have a conversation with them. And so I'm all about getting a second opinion if it feels like it'll help you make better informed decisions about your healthcare. I think being empowered as a patient is really important, and most doctors will get that and be okay with it. If they're not, that's not your problem. Your problem is to get the best healthcare you can. I will also say that don't hold stuff back. Don't hold stuff back because you don't think that the doctor is going to understand, or you don't want to tell them because you're embarrassed. To get the best healthcare, if you're concerned about your health, you've just got to tell them what's going on. Don't leave out symptoms. Try to get over whatever feels difficult or embarrassing to talk about, because we can make the best decisions when we have all of the information. We don't make the best decisions when the information is incomplete, and so that's the way I tell folks to approach it.
Your point about a second opinion doesn't mean you're leaving your doctor is a really important one, and I want to
Yeah.
echo that. I also want to point out the reality that as doctors, many of us, and I put myself in that, when a patient asks for a second opinion, it feels like you don't trust me anymore.
Mhm.
So we have to admit that. And that's probably why it makes it harder for some patients to ask, especially if they feel like there's a relationship. It's not that you're saying you don't trust the person, but you want to know more information. And if you can afford it, if you have the resources, I think it is really important to always think of it as, is this all the information I need to make the best decision for my health?
Yeah.
So thank you for putting it that way. I'm going to switch it a little bit to something that I think about a lot. Some people know I'm former military and was in military hospitals a lot. And I believe that signaling is really important. So the days when I showed up in my uniform, I'm treated differently than the days I'm in jeans and a sweatshirt. Some days I wear something that says medical on it so that I get treated differently. Is this all in my head, or do you all think that signaling like that makes a difference? Because among Black folks, we say all the time, you have to dress up to go to see the doctor so they treat you right. I don't know how real that is because of my past experience through the military, but I believe that a lot of people at least feel that way.
Mm.
Tracy, what do you think about that?
Yeah,
Especially in the
and let me ask you just to make sure I'm clear about what you're thinking about. Are you thinking from what the doctors are signaling to patients, or what patients signal to their doctors when they walk through the door?
what patients signal to doctors,
Yeah,
right? So
yeah.
if you're wearing something,
Mhm.
are you worried that your doctor is going to judge you a certain way? Does it
Yeah,
matter what you look like in order to get the treatment that you deserve?
yeah. Here's what I'll say about that. I think there's two ways of looking at it. One way, fair or not, people form opinions about you from your appearance to some degree. It's the first impression. And it means different things to different people. Some people are aware enough of their tendency to do that that they can acknowledge that they're having that experience and move past that to work with the person in front of them. And some people don't. So that's one part of it. The other piece that I actually think is more important from the perspective of a doctor, especially a child psychiatrist, is I absolutely look at my patients, because how they present to me in my office tells me a lot about what's happening with them outside. And so if I have a child coming in, and this child is coming in for depression or behavioral problems, and I see bruises and torn clothes and they're dirty, I'm going to think about, is there anything about this child's safety that I need to be concerned about? So I'm looking at those things to start having a context of what I see with the person that's coming to me. So appearances matter in ways that they should, because everything is fair game when you're trying to help someone who's coming to you for help to understand what's going on with them. People don't come in as symptoms, they come in as whole people. And whole people means how you sound, how you look, how you physically move, what you talk about, like all of that is fair game. It also unfortunately allows people to form biases. And just know that, know if you walk in and you're a 16-year-old adolescent and you have your pants hanging down and that, and you're going in to see a 65-year-old white guy, he's going to have presumptions about what that means. And maybe he gets it enough to know that he has biases and he needs to get past that to help you, but they don't always have that. And so we just need to be very clear and honest about that.
Fantastic. Chinwe, what do you think?
Yeah, I do agree that appearances can create certain first impressions. And I'll give you a prime example. My sister, she's younger than me, and when she went to her OBGYN appointment when she was first married and expecting her first child, the first time she went and she didn't have her wedding ring, the conversation was very condescending, in a sense where she felt like the provider assumed that she was going to be taking care of the child by herself. And she's like, no, I'm married, and then it was only until she mentioned that it seemed like, it was a different approach, talking about like, wholeness. It was just a different feel from her. And I think I've, experienced that in certain levels. And even when I go to see the provider for myself, I don't always tell them that I'm a doctor, even with my children. And I've noticed the difference whenever, I say that, and sometimes I don't say it. They have to ask, like,
Mhm.
in the forms to fill out. You write what your profession is. But I've noticed a difference when, they've looked at that form and known my profession versus me just coming to a provider for my kids and asking questions just like a regular mom. I see that, and I see the importance of really trying to meet every patient where they are to some degree. You may start out with biases. I don't think any human can come and say that they are without bias. We all have biases. It's just a matter of being transparent about them and disclosing them to some degree and say, hey, I'm asking this because I ask all my patients this, or, I'm going to try not to assume, but could you, further explain to me, blah, 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 blah. But always leaving that opening for your patient to clarify who they are, what context they're coming from and how they need to be helped. I think if we come from that perspective, then we're able to not allow our biases to cloud our judgment and how we care for this patient.
Fantastic. So as we get close to wrapping up, I'm going to ask you both again to talk about what would you tell family members in order to get the best care themselves? And I'm going to take the liberty of starting this time so you don't get the good answers that I was going to say. But when I have a family member or a cousin or anyone call and ask, what should they do? I always tell them to ask the provider, is this what you would do for your family? Is this what you would do for your wife, yourself, or someone else? What that does, and what I let them know, is it shapes it reforms the way they're looking at you. So they may just flippantly say, yes, this is what I would do, but at least it makes them pause for a second and think, am I treating this person like I would treat my family? And for me, that is one of the best ways for people to advocate for themselves, to get the physician, the nurse practitioner, whoever's taking care of you, to see you as more than just as the whole person that you are. All right, Chinwe, what would you tell your family?
Yeah, I think I like that. That's really a good one. I think for me, I think it's always, I tell them whenever you're being offered a recommendation, see it as a recommendation and not a mandate. And always say, is there any question or is there any information that you still need from me to inform this recommendation? Like what are the options? What are my options? I may have told you this, but are there other options that we have not yet discussed? So at least it allows that provider to pause and think through their differential as opposed to coming in with a one size fits all, assessment and plan. But to say, oh yeah, well, if it was this, then I would have expected you to tell me blah, 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 and blah. Or if it was this, so at least it shows my family member that the provider has really thought through all the, the gamut of conditions that could be related to the symptoms that they're presenting. So yeah, that's what I would say. It's just ask questions about other options and other things. Because you're right, what Tracy mentioned about the history. The provider really tries to make their best judgment based on the history that they're given. But if there's some information that maybe the patient may not have, or considered as important or relevant, or maybe they didn't share it. Again, sometimes some things are overlooked, but it's with the information that they receive that the provider makes that judgment. And so it's always a question to say, oh, if you think through all the other differential, then maybe the patient will say, oh yeah, I did have that, or oh yeah, I didn't even think about that. And so just something to cover all your bases.
Yeah. You guys, this is all so good. This is such good stuff. I wanted to go back to one thing Jeff said, was this suggestion to ask, what would you do for your family member, is so good. And one of the reasons is because that gives the physician an opportunity to humanize the person. So you're no longer just a patient, but you're a person, and you're a person that maybe they can connect with when they connect with someone in their family. And racial discrimination, bias is a part of a continuum of dehumanization. And so that helps that process a little bit. So I love that recommendation. I'm very practical with what I tell my family members, what I tell families to work with. Number one, prepare before you go to your appointment. know why you're going, know what you think you want to find out from that appointment. Like, what are you wanting the doctor to help you understand or do? And take questions. Ask questions, write them down before you go if you need to. I tell a lot of my families at the end of our appointments, look, this is not the last time you're going to see me. And so if you have questions that come up beforehand, you can always reach out, give me a call, but you can also just write it down and bring it with you to the next appointment. So write your questions down. I also tell families, this is less, I think, less for kids, but more what I actually tell my own family members. If you have a friend or family member who you trust, and you're going to a pretty important appointment, an appointment where you may hear about a new diagnosis or have to make a decision, take someone with you. Because a lot of times when we're in high stress situations, we miss a lot of information because our brains are at a point of stress, and your ability to receive and learn from information is less in those situations. And so taking someone with you, maybe someone who can take notes, someone who can remind you of questions you were supposed to ask, can be really supportive. Again, a person you trust, a person who understands what you're seeing a doctor for, if that person is available to you to do that. And then piggybacking on what Chinwe said, but I really want people to understand this. It is rare that you're going to an appointment where you have to make a decision about something then. You can almost always leave that appointment, take that information, think about it, talk to someone else about it, try to understand if there's any other information you need before you have to make a decision. And unless it's an emergency or an acute situation, you almost always have an opportunity to take the information you received and really think about the decision you need to make. And so those are things that I tell my family, that I tell families I work with, that I tell my family when they're dealing with something medical and they just need some support going to the doctor.
Yeah. If I may add real quickly, but Dr. Asamoah, what about COVID? I can't bring somebody with me for COVID.
Yeah, you can though, right? Because we all have these.
Exactly. I was going to add that.
Yeah, I have families.
Yes.
Yeah, and so I work with kids and adolescents, and often only one parent can come. And there have been tons of occasions where we pull the other parent up on the phone and they're with us in that way. So there's ways to get around. I also now can put that back at you. Well, are you in their office or are you seeing them through telehealth? So if for some reason you feel like you need someone with you, well, I won't say that. A lot of practices offer a telehealth option right now. And so if you want someone else with you, say, well, I want to be able to have, my sister or my spouse with me. And so we're going to do it from home so we can both be part of the conversation. So that's not an excuse. It may be a barrier. It may be a potential barrier, but there are workarounds.
I didn't say that this is all because this is going to be in the cyberspace and it's
yes,
going to.
And you want to give this information. Yeah, no, that's a good point. And the other thing is, when you call to make your appointment, ask. You can always ask, hey, I really feel like I need someone with me at the appointment. How do you support patients that need that?
Yes.
Yeah.
Great. Dr. Asamoah, Dr. Faribe, you two are fantastic. I'm so happy to be part of the same organization you are. For everyone listening, thank you for spending time with us. We're grateful for this time. Thank you for being who you are, wherever you are. ABPA wants to continue to decrease health disparities and inspire the next generation of Black doctors. And we do it with your help. Please visit our website, austinbpa.com. Reach out. And if you want to partner with your organization, we're here. Again, thank you very much.